Welcome back. It's all about preventing meningitis and health matters. You can join us in this discussion by calling number 0808 054 2233, or you can tweet at yomi_Otaibe. Okay, before we went on that break, you talked about the fact that there's no confirmed case of meningitis in Lagos. So tell us, when people have suspicion of, okay, this person may have the symptoms that you've mentioned, what should they do?
Well, I think the first thing to do is to report to the nearest health facility to be seen by health personnel, who now decides whether the case is suspected of case of meningitis or not, and the patient will be admitted and the appropriate investigation will be carried out on the cerebrospinal fluid and sent to the laboratory. So then patient can, commence other treatment.
Is this diagnosis, can it be done just in a lab, or?
Well, it is microscopy, culture, and sensitivity. As long as they have the facility, the bottle for collection of the sample, and then the reagent and all the other instruments to do. But in our laboratories in Lagos State, they do the culture and sensitivity, and then in Lagos also we have the Central Public Health Laboratory of the Nigerian Center for Disease Control at Yaba, where they also conduct this test. But first, with good microbiologists and they can get it done. We have microbiologists in our different secondary and tertiary health facilities in Lagos where this can be conducted as well. If
we look at the fatalities that have been recorded mostly in the northern part of the country, those states I mentioned earlier, you would think that it's a question of this particular serotype is so virulent that, before the person gets to the hospital, or could it be a case of people not presenting early enough?
Well, I think this is not the first time we are having, epidemics of cerebrospinal meningitis. Even with the A type, you have a very high case fatality rate. With the C serotype, is also because when we look at the different serotype that can cause epidemic, we have the A, B, C, W, 135, and for some time A might be predominant, but it's not as if we don't have the C, during those epidemics. But this time around, the C in serotype is almost more than 80% of those that were diagnosed. I also think that a lot is going on to ensure that the death toll and then the number of cases, because all these are through transmission, that with a lot of processes put in place by the Nigerian Center for Disease Control. We have the Emergency Operations Center for Meningitis in Abuja. They use the incident management system, and we have different teams. So with the epidemiology and surveillance team doing contact tracing and trying to make sure that they get cases done, and with the reactive vaccination that is also going on, social mobilization, education and enlightenment is going on. There is a WhatsApp group where you have all the epidemiologists and the surveillance officer in the country with the EOC of the group. And also in Lagos, a lot is being done. We've circulated the fact sheets to all the health facilities with the treatment protocols in Lagos State, both public and private. And you see the commissioner has also made press briefing on informing people about meningitis, and our surveillance system is also on strengthening it as well. Is ongoing. Is something that we do most of the time. We have tried to sensitize our disease surveillance and notification officers and all the local governments.
Okay, tell me, how important is it to get treatment, early treatment for this meningitis?
As I've said earlier, it's very, very important. If the treatment is delayed, patients can die. So that is very, very important. It should be reported early to the health facility for the health personnel to take, to institute the appropriate interventions.
And it's not something to self-medicate about?
No, this is not.
Okay, now let's talk more about the prevention.
Yeah.
Take us through this process.
Well, for the prevention, let's look at it from the individual level. What it means is that, one, we should avoid overcrowded environment, at least at this point in time, since we know that it's easy for the droplet and co to be transmitted through that. And again, we should also reduce close contact with people who are suspected or even have meningitis before it is being diagnosed. And on top of it all, it's very, very important for all diseases, personal and environmental hygiene, especially hand washing. You shake. This point in time, somebody sneezing with catarrh and everything, you need to wash your hand with soap and water. Is very, very important. Yeah. And also another one,
washed.
Yes. And another one
and
is
the hand washing. I think there's a technique.
It has its processes, and that can also be found online. And you wash the different parts, starting from the hand, going through the fingers, going through the back of the hand, moving down, and then going in between it, the thumb. You wash all those. So those are the techniques, so that you don't miss any parts of the hands that you are washing. And then, most importantly too, anyone who have signs of fever, neck stiffness, headache, or any of the ones we have said before, should report to the nearest health facilities, or there are some numbers from the Lagos State government that the person can call and we can direct appropriately.
Okay, and you don't have the number offhand now?
I have it offhand, I can call it.
Okay, please go ahead.
0802 316 9485.
That is
0802 316 9485.
316 9485. Okay, that's the number to call just in case.
That's the first number. Then the second one.
Okay.
0802 0803 717 0614.
14. So if anyone's got suspicion that someone may be having, or it could be someone's family member,
you can call
the numbers
numbers that we have stated. So, but
it's not a number that will just be ringing forever.
No, you'll be giving the appropriate responses on what to do as at that point in time, and the details about the person will be called, and we can also follow up, can direct the person to the nearest health facility, to the local government that person comes from.
Okay, now let's talk about vaccination. I know that is very, very key. Who is eligible for it?
Well, for these particular epidemics, what I know is that the serotype C vaccine is not readily available, and through the Nigeria Center for Disease Control, National Primary Healthcare Development Agency, we have reached out to International Core Group, ICG, for vaccine. And the vaccine available now are also limited to use for states that have, the epidemics.
But for
more doses are being requested for, and they are waiting, these doses to be supplied to the country. So, but in areas where you have epidemics, for example, we look at a population of over 30,000, and you have 10 cases per week. That's is epidemic threshold. Individuals within that ward, within that area, will be given what we call reactive vaccination. Some people call it mass vaccination as well. So by that time, you are trying to boost the herd immunity, and that will reduce the infection, the spread of the infection to other people in other areas in that particular place. But for now, if the vaccine is available in very large quantity, might go around.
What about the A serotype? We have vaccine readily available for that.
There is vaccine.
Okay. And so where can we get it? Any public hospital, private?
Well, for now, at least you can get in public hospital, though it is not in the routine vaccinations. I think there is plan is on the way to to put it in the routine vaccination immunization schedule, but presently it's not in the routine immunization schedule.
Thank you so much for joining us today on the program. We've been having a chat with the consultant public health physician, who is also a state epidemiologist with the Lagos State Ministry of Health. Thank you, Dr. Abdul Salam.
Thank you very much. Thank you.
And that's the show for today. Thank you all for being a part of it. I am Yomi Otaigbe.